Mark Laret, CEO of UCSF. Welcome to Stanford and Systems Leadership.
My pleasure to be here.
So tell us a little bit about UCSF and your role in the institution.
Sure. UCSF is one of 10 campuses of the University of California, and it's unique, and it's the only campus focused exclusively on health services, health sciences, and it's only graduates, so we don't have any beer busts on Friday or fraternity row. It's all medical students, dental students, pharmacy students, nursing students, plus a graduate division, and then the healthcare delivery system, and that's the part I'm responsible for. All in, UCSF is about a $6.5 billion operation. The health system is about $4.5 billion of that.
Now, UCSF was recently named one of the best hospitals in the nation, and there are a lot of changes going on in the healthcare system in our country. How are you seeing that impact your business and the people who work on your team?
Well, first I'll just say about all surveys, if they rank us highly, we're very appreciative of the methodology. If they rank us poorly, we just dismiss it. But I do think the rankings do reflect an underlying strength in our technology and innovation, and particularly our strength in delivering high-end tertiary and quaternary care. The challenge for all of us in the healthcare industry is we're not quite sure what the underlying economic business model is. We've been told we're moving to a population health model for a long time. I thought by now we would be well down the road of all looking like junior Kaisers, but fee-for-service still is the dominant form of the business. And when you're not sure how your economics work, it makes it hard to, or makes it harder to make decisions. We have just made the decision we're going to act as though we try to place our bets on a population health future, but assume there's just a modest transition and that we're continuing as we have for the past. So it's a hard time for everyone in healthcare, and particularly because it's so political, everybody's always threatening to tinker with the system.
Now, within that context, how do you think about new types of digital technology or personalized healthcare and how that impacts what you're able to do with your patients?
Well, I think we have a lot of issues in healthcare. One of them is cost, for sure, and one of them is quality, and one is patient experience. And I think that technology has the ability to reduce errors, improve reliability, and reduce cost. We see it whether it's robots that we use in our new Mission Bay Hospital that they don't unionize, they don't strike, they just carry linens, they carry drugs, they carry food back and forth all day long. Or what we're doing on electronic medical records and others. So I think the whole healthcare industry is so ripe for a technologic advancement, and we've been slow. There's some legitimate reasons why we've been slow, but we've been slow to make those adoptions.
How do you decide who you want to work with? There's so much activity going on here in Silicon Valley, and you're at the heart of it. How do you choose who to engage and with whom you say, let's wait a bit?
Yeah, I think it is a challenge. In fact, we set up a separate unit, our Center for Digital Health Innovation, that we try to run suggested ideas or new proposals through, so we can kind of do some preliminary screening. But in general, we're looking for things that are that save money or save lives or improve processes. We're looking for things that are secure. We're looking for things that are scalable, and we're looking for things that are seamless. So even if we get an innovation that requires us to undo all of our interfaces with existing systems, it's not worth it for us, unless it's got some profound impact on reducing morbidity or mortality. So we're trying to simplify our lives and have things work in a common interface. So we're looking for innovations that can work well with that.
How early will you bring a company, an outside company, into working with UCSF, given the complexity of the system within which you're working?
Well, we're always open to new ideas, and we encourage people once they have a proof of concept, we're looking at it. But you know, I was just thinking about mistakes I've made. I was a big believer in Elizabeth Holmes and Theranos before we learned that there was nothing there. We were an early investor in AwarePoint, which just went bankrupt this week, and this was a technology to track capital equipment inside the hospital. So we're willing to try new things, but almost in every case, we're looking for an organization that knows the space extremely well, knows the adjacencies and the interfaces, and can work well with us, and we're willing to give it a try.
All right, so let's go to the other end of your ecosystem. Let's talk about government regulation and how that impacts what you do. How does that drive the everyday behaviors of you and your team? And again, how does that get tied to patient outcomes?
Absolutely everything we do is regulated. You know, how far off the floor or from the ceiling we stack things is regulated. Who can put an eye drop in your eye is regulated. You name it, in healthcare it's regulated. And I think for legitimate reasons, because it is a life and death industry, and the expectation is this is a place where no mistakes should be made. And I think some of the tension that happens between healthcare and the tech world, where make mistakes often and frequently and learn and constantly evolve, bringing those two together, by the time they come together, the healthcare industry is saying, no mistakes here. This needs to be worked out, because we're not going to put our patients in harm's way. And so that becomes a real challenge for us. But I think the regulatory environment is what it is. It's, I wish it were a little more stable, because unfortunately it's become an R versus D on how they think about regulation, and we're never quite sure, again, what's coming next.
So as the CEO of this business, you deal with doctors, you deal with researchers, you deal with patients, you deal with technology, you deal with the government. How do you spend your time as you think about managing the broader company and organization? Yeah,
well, that is I think the challenge for every CEO. So last week I was in Washington, D.C. On my way over here, I was on the phone with the dean of the medical school. And a week ago we had a strike at UCSF with our nurses and other employees. So the positive spin is it's a very diverse, interesting, engaging environment. But the challenge is maintaining a strong relationship with all your stakeholders, making sure you thoroughly understand what's driving them and motivating them, and trying to work productively with them and find a way forward that helps the company grow, thrive, prosper, and better serve our mission.
Of all of our guests that we've had so far this quarter, I think that your job may in fact be the most complex. You've got an ecosystem with a variety of constituencies, and it really is dealing with life and death. We're really appreciative of you making the time to come here to Stanford and joining Systems Leadership.
My pleasure. Thanks so much.